You're listening to Health Professional Radio with Wayne Buckler. Joining me today, my guest is Gary Bird. Gary's the Country Manager for MEDA Pharmaceuticals, and he joins us from Sydney in Australia. Gary, welcome to Health Professional Radio.
Thanks, Wayne.
Now, Gary, I have to confess my ignorance here. I don't know anything about MEDA Pharmaceuticals, so can you give me an idea of who you are and how big you are?
Sure, Wayne. Well, you're not alone there. Not many people know who we are. MEDA's it's actually an international company. It's a European base, but it's only recently expanded into the Southern Hemisphere. So we're actually the 48th or maybe 47th largest pharmaceutical company in the world. We've got over 3,000 employees globally, and we're quite big in Europe. More recently, though, we've expanded in the Southern Hemisphere with markets in China, Australia, South Africa, and Brazil.
So in Australia, your footprint's now Australia-wide?
Yeah, that's right. We cover Australia and New Zealand.
All right. Now, I'm much more confident that I will know some of your brands than knowing your corporate name, but we'll come to those in just a minute. When you say you're a pharmaceutical company, is that kind of over-the-counter pharmaceuticals, or is that prescription pharmaceuticals, or do you supply to government or the health departments or to the public? Just sketch in some of the detail for me.
No problems. We are a combination of specialty pharmaceutical product and over-the-counter product. So no particular supply into the government, but the traditional pharmaceutical route of supply to pharmacies and hospitals. And as I mentioned, a mix of prescription pharmaceuticals and over-the-counter products.
Give us some sense of some of the products in your range, Gary, because it's without slipping down the pharmacy to go shopping and looking at the fine print. What sort of products do you have in your range? Yeah,
our lead product at the moment in the OTC category is Waxol. It's actually the biggest earwax remover in Australia, would you believe? We sell over 500,000 units a year now, and that's available at any pharmacy and actually in Coles supermarkets. And then beyond that, we sell a nasal spray for hay fever. It's an antihistamine nasal spray called AZEP, and we have an antihistamine eye drop called IZEP. They're both popular over-the-counter medications in pharmacy, and we've just launched a new product range called Limicin, and it's a range of products to treat head lice. So that's a good representation of our OTC portfolio.
And for all of us with children, products for head lice is something near and dear to our hearts, I have to say.
I do understand myself.
It's like you can pop along to a meeting of parents at any primary school and start a conversation about head lice, and everyone has a view.
It is amazing how many dinner parties I attend and end up talking about head lice.
See, fortunately, my children are now old enough to have children of their own, so I'm one generation removed from a lot of those conversations these days. Gary, 95% or so of our audience are clinicians of one kind or another. We get doctors, nurses, allied health professionals, mainly in either acute care or in aged care. Is there a takeaway message that you'd like them to get as a result of having had a chat with us today?
Yeah, sure. We've got a couple of key prescription products. One's Elidel, which is a cream for eczema, and it's the only non-steroid-based cream available for eczema. So that's a terrific option we've got there in the prescription space. But the main one I wanted to mention was Dymista. Dymista is a new combination therapy for hay fever or allergic rhinitis. The first one in the world to combine both an antihistamine and a corticosteroid. It simplifies hay fever or allergic rhinitis management and is a new gold standard in the treatment of allergic rhinitis.
And Gary, I guess for people who want more details of those, they can get that at your website.
Yeah, absolutely.
Is that the best place to go? So just give us the URL for that if you would.
Yeah, that's fine. It's www.meda.com.au. And you can find information about all our products there, particularly about Dymista. Otherwise, they can contact us via that website, via email or phone, and we're happy to send information out or send anyone out from our sales and marketing group to have a chat. We're not a big company, but we've got a team out there, and we're out there promoting the product. It's, as I said, the new gold standard in the market, and it's now the fastest growing hay fever product this spring.
And that was MEDA, meda.com.au. Gary, in every business there are misconceptions, and it's my favourite question in every interview. What's the biggest misconception about your products and services that drives you nuts and keeps you awake at night?
Good question. Look, actually, the main one's about Dymista. Often people look at hay fever and think it's not that serious a condition, and most patients are controlled these days on what's available out there for hay fever, either a nasal spray or a box of tablets when you walk into a pharmacy. Actually, there's a bunch of studies out now and good research showing that over 70% of patients are co-medicating. That is, they're taking one hay fever treatment, but they've got to go and find something else to help control their hay fever. So actually, we see a lot of hay fever sufferers who are self-medicating, and they end up paying far more than what often their clinicians or pharmacists are aware. And so we're encouraging all clinicians to look at their hay fever patients, ask the questions about whether they're well controlled, and to consider Dymista in those patients.
Well, today we might have helped cure a little bit of that misconception amongst our audience. Let's hope so. Gary, it's been a pleasure having you available and making yourself available to chat with us. I know you're a busy man. I do want to just give that website a mention once again, because I'm forever getting into trouble for not giving people warning. So pencils ready, people. It's www.meda.com.au. Did I get that one right, Gary?
That's correct.
Thank you, Gary, for being with us. If you just missed my conversation with Gary Bird, the country manager for MEDA Pharmaceuticals, the good news is we have a transcript. So on our website, the Health Professional Radio website, www.hpr.fm, you can find a transcript of my interview with Gary. You can also find an audio archive on SoundCloud and on YouTube. My name is Wayne Buckler. You're listening to Health Professional Radio.